on minimizing system-related factors contributing to diagnostic error. To moderate this crucial discussion, I would like to call upon Ms. Thankam Gomez to the stage. The stage is yours, ma'am.
Now it's my duty to call my panelist. Before that, I set my timer. Yes, very important. I start. 30 seconds finished. Okay. Gives me immense pleasure to invite Dr. Sangeeta, Colonel S.G. Jyoti, Mr. Akshay Oleti, Ms. Sindhu M.G. to join me for this panel discussion. So please come on the stage. Oh, Mr. Akshay Oleti is emerging from the audience. Thank you. It's okay. Yeah. Welcome to the panel, and we know this is our last, session, and the group is still there. I hope they are listening. Are you? We have a responsibility to make sure that this goes well, and nobody is sleeping. Okay? If anybody is sleeping beside you, just raise their hand. Then I will say, oh, what question do you have? Okay? That's an agreement. So let us come back here. So welcome Dr. Sangeeta. I'm going to introduce them. Can you put their slide up, please? Dr. Sangeeta is consultant microbiology, Manipal Hospital, Whitefield, Bangalore. And all of them, in all the slides, I hope from morning all of you kind of noticed whether this last line, your view on patient safety. If you have watched that from morning for different speakers, you would have learned the story about everyone. They are talking about that is the thing that everyone has to maintain, that is to ensure there is trustworthy system, the caregivers needs to focus, first do no harm, and all roads lead to patient safety, and we have no right to harm the patient. So very happy to have you here with us, Dr. Sangeeta. And if you look around, you can see that this is the multidisciplinary panel. We are two nurses? Only two. Yeah, we are only two. So let me introduce the next nurse, that is Colonel S.G. Jyoti. She's the Deputy Principal Matron, Command Hospital Air Force, Bangalore, and also a member of ANI. Ma'am, very happy to have you here. I forgot to tell you to come in uniform. I love to see people in uniform. I like to be just near them to say I also look very, very tip-top, right? Very happy to have you with us. Thank you very much for being here. And so we'll start talking to them in a while. And now I move on to Mr. Akshay Oleti, VP Business Head, Fortis Hospital, Bangalore. Fortis Hospital is my mother hospital in India. So I'm always very happy to meet people from Fortis. I'm double happy to see such a young person. I don't know how young you are. I won't ask your age, okay? But very happy to have you in the panel. Thank you so much for being here.
Thank you.
And he's a business head, please remember. So we got a business head also to talk about patient safety. Then we have, last but not the least, I stumbled upon meeting Ms. Sindhu MG when I went to NIMHANS. I happened to go to her office and I met her. She's the head of biomedical engineering. When we started talking, I said, oh my God, to find a biomedical engineer talking about patient safety, pharmacovigilance, and what's that, medical equipment vigilance, I got so taken up. I said, you have to come to this conference. So you are here. Thank you so much. So I cannot talk more about many, many things because you have some things to share, right? So my first question to all of you, we will keep it short and sweet. I don't have a table. I'm just trying to keep my timer somewhere so that, yeah, no worries. So my question first of all is that, our topic is about having systems and processes to ensure safety. So we are not going to repeat what has been discussed. So my first question is that, do you think that we should focus on systems and processes to ensure patient safety in our hospitals. So I request all of you to just take 2-3 minutes and give very smart and very compelling answers. So where should we start? A, B, C, D, E, F, G, H, I, J, K. Huh?
No problem. Yeah.
So now here it is, pehle aap. Yes ma'am, pehle aap.
Sure, I'd love to take that question. If I'm getting it right, you said, are systems important? Is that the question? Are systems important?
Systems and processes are
Yeah.
they important to ensure patient safety?
Yeah, absolutely. What I would like to mention first and foremost is that the care is not based on a single person. I may be bad, he may be very good, she may be excellent. But when we are talking about an organization, when we are talking about the care which is being rendered, it has to be put into proper places. It should not be dependent on a person, it should be dependent on the system and processes in place. Like I keep mentioning always, the dazzling building or the shiny equipments do not make the place. What makes the place is the system and processes which brings out the outcome rather than anything else. It's not anything else that matters. The people, the humans who put the system and processes in place, which brings the desired outcome. That's my view on systems and processes.
I totally agree with you that it is very critical. So let's move the mic to Mr. Akshay, your VP Business Head. Now, what's your thought about having processes and system in place to have more business or to have more patient safety?
So first of all, I'd like to clarify that I don't like my designation. Nobody likes to be called as the head of business in the healthcare industry. But unfortunately, designations are designations and there is very little you can do about them. But coming back to the question, ma'am, a wonderful question. Fundamentally, we have for-profit, not-for-profit organizations providing healthcare, but none of that matters in front of the patient. The number one priority that we have to give is patient care and patient service. If we are doing an excellent job of that, money will follow, right? One wise man once told that money is like oxygen, right? Without money, it is very difficult to survive. But we are not born to have oxygen, right? Our purpose in life is not let us breathe oxygen and die, right? So money will come as a byproduct. We all are educated professionals. We all have crossed so many challenges. If the objective was only to make money, it would have been something else, right? Which would have been a quick way of giving money. We are all doing these things to make sure that we are in a, like Professor Ramsey told, we are like guardian angels. Our job is something much more holier than what others do, and that is what we take pride in. Money will come later anyway, right? So,
Fantastic. That's nice to hear money will come later. So that reminded me of someone, I used to tell this to my nurses. Healthcare is business, but it's the business of healing. We are in the business of healing, right? So with that, I would shift to Dr. Sangeeta to give the first round about the importance of systems and processes. And you're coming from the lab and microbiology background. I'm sure that your answer is going to be totally compelling. I can kind of envision that. Please tell us.
Yeah, so regarding the laboratory perspective, everybody thinks that you give 2 drops of blood and we give a report. Okay, so the 2 drops of blood which is given to us, it undergoes a system, what we call it as a laboratory cycle or different. Each step is being monitored or each step is being analyzed there. So related to the systems, we have basically 3 systems, what a laboratory cycle means. So we have a pre-analytical phase, an analytical phase and a post-analytical phase. Okay, so each thing is very important as the audience is more of the nursing part. So I would like to stress on the pre-analytical phase which we undergo, and most of the laboratory errors we attribute it to the pre-analytical errors which occur mainly before even the sample reaches the lab. Okay, so the pre-analytical phase starts from the time a doctor thinks about ordering a test and till the sample reaches the lab, that is what we call as a pre-analytical phase. Now I'll quote you a few examples of pre-analytical errors which we usually face, and usually comes from the people who collect the sample, even from a doctor who is ordering a wrong test. So beginning from a few examples which we need to quote are maybe a doctor who is ordering a test for a fever. So the patient is in the first week of fever where he is mostly suspecting a typhoid fever. But in the first week, you know that only the blood culture comes positive. The Vidal test, which is commonly used, it comes positive in the next week. So the doctor is not aware, so he orders in the first week itself a Vidal, and we give a Vidal negative. And he tells, okay, you don't have typhoid. He may give some other treatment to the patient. So there itself, there is a significant pre-analytical error which has happened. So this is one of the system error which has occurred from the doctor. Now coming to the nurses part, who you are involved in mainly collecting the sample. So there are a lot of examples where we get lot of samples to the lab. The main errors is a misidentification. I think one of the quality improvement project was misidentification. So you can imagine the error that comes out of a misidentified sample is going to be very, very critical to the patient. Okay, we may lose a patient if a sample is misidentified, and most probably in collection what happens is a small error from the patient. Sometimes they don't even know what container to send. A doctor is doing a surgery to take out a sample, he's suspecting a malignancy or a tumor. He has taken out the tissue and he wants to send it to the lab for a biopsy. But the patient who was, or the scrub nurse who was there, she put the sample in the saline and she's sending it to the lab. The saline, the tissue has gone. You have to preserve it. You have to put it in formalin. So there itself it has gone, and you are losing a precious sample which has come out of an OT, and the sample is lost for diagnosis, whether it is a malignancy. So the surgeon needs to decide whether should I remove the tumor or keep the tumor or whatever it is. So all simple things in each of the systems related, what I told you is a pre-analytical, let it be, or an analytical phase or a post-analytical phase. It can all lead to very severe problems in the patients. So if I explain, it will be a lot, but few examples I had to quote for the pre-analytical phase, as you people are mainly involved in that. So that's why I stressed few on simple things which needs improvement.
Thank you, Dr. Sangeeta. That takes me back to when I was a CNO. I don't know how many hours I will waste trying to investigate why a sample went in the wrong container or in the wrong vacutainer. I have seen it myself when the CSF fluid was removed. They had to do a count, CBC, but it was not taken in the right, vacutainer, so the count could not be done. There's no way you can go and do the LP again for a patient, So I totally agree with you that the nurses have got a huge role to play to ensure that we have the right results that are coming in, so that we can have the right diagnosis for the patient. The theme itself says, to have improving the diagnosis. And all the people sitting here, we contribute to the diagnosis that is happening. And from morning, we had a good panel discussion when Dr. Sonali discussed about the role of nurses, So we'll come to that later, but now let me move on to Ms. Sindhu. So you are head of the biomedical engineering department, and we take all kinds of equipments and monitors and machines through your department. So how do you envision the need of systems and processes? Let's reflect on systems and processes. Why is it important, and what are your thoughts on that?
Good evening. Thank you, ma'am, for the question. So actually, we are into this patient safety movement through the Material Vigilance Program of India. We came across a lot of adverse events associated with the medical devices. We really require the support from the front line who touches and treats the patient are the nurses. So we all know that the biomedical engineers in a hospital is very less, 1 or 2 or maybe maximum of 10 numbers for a 1,000-bedded hospital. So what happened to our own facility? During the COVID time, we had the major challenges, like the doctors are being treated based on the reports alone. So what all the RT-PCR test kits and what all N95 masks we got, what all PPE kits we used, what all respiratory devices we had, how many ventilators have come into the market, all those things were generating a lot of adverse events. So we were not in a position to even assess those adverse events because all were in a panic situation. where there only the major adverse events reporting from the Indian Pharmacopoeia Commission has been reported, and it was a shocking revelation that none of the N95 masks or most of the N95 masks were not applying to the biocompatibility test. There was no time for any of the manufacturer to do any test. And now we are, I think, who is treating us? That was the question I think I was discussing with Tankam ma'am when she visited NIMHANS. Ultimately, who is treating us? So the two videos which we have seen now, so those, both the results were given by the machines. So the machine is not being calibrated or the machine is not giving the intended results, then the patient or the recipient on the other side is at harm. So we are talking about a preventable harms only. We may not be able to reach zero harms, but I think the first step that we can slowly start journey towards reaching to a zero harm. So I think it is very important that system should be in place, like device procurement onwards to the life cycle management. So the system should
Totally,
be.
I think you will also be depending on the nurses to speak up when their equipments are found to be malfunctioning or it is not enough for a particular job that they need to do. They need to be escalating. So nurses have a huge role to play. So I'm going to change the format a little bit with all your permission. Is that okay? So please prepare your questions to ask the panelists, any one of them. You can prepare while I am going to ask them this round of questions. The third round, we are going to take questions from the audience. Is that okay? So generate some excitement in the audience and also to make sure nobody is sleeping. And if they don't ask, I will ask them questions about what you were speaking. Is that a deal? Absolutely, that's a deal. Okay. So, Colonel Jyoti, I would like you to reflect upon the role of nurses, especially related to adhering to systems and processes. Why is it important that nurses need to be aware of the systems and processes, not to look at it as it's like a danda coming from our protocols, you know. Why is it important that we need to be aware and we need to have this attitude of doing the right things every time?
So coming to the topic, the first and foremost, I want to speak on three major premises, especially about the diagnosis. Diagnosis is not a one-time diagnosis. It doesn't mean that if a patient has come to my ward, he has been or she has been diagnosed and that's the end of it. That's not what it is. And secondly, that nurses are the ones who are there 24/7, which we all know, that 24/7 we are at the bedside and we are the ones who are the most important bedrock in being there for the diagnosis. And third, what I would like to say is that safety culture is not only meant for hospitals, it should be extended to the community too. And what I personally believe is that patient safety need not be discussed only in the hospitals, it has to be extended even after they discharge and before they come to us. Now coming to this, first of all, since morning we've been hearing a lot about communication, okay? So many people told me, in fact I was speaking to one of the ladies whom you are working on with communication for her. I think the communication is a bedrock for us because whatever nurses identify, whatever the nurses know, even if it is a senior nurse, if she is not approachable, the junior nurse will not talk to her. She will not tell her anything. Leave alone the doctors. Even the senior nurses, if they become a little, I know everything. As a senior with 34 years of experience, I may know much, much more than a junior nurse with 2 or 3 years of experience. I should not imagine that what I know, she also knows. So I should go to her level and make her understand that it's okay, whenever mistakes happen, we do get back to it. So that is a kind of system we need to have in place, that there are problems and these problems need to be highlighted. Whenever I personally feel is that if there is something going wrong, it's the system in place which is wrong, not the individual who is wrong. If the individual has done a mistake, that means there was a scope for making a mistake. So identifying problems when there are errors, if it is reported on time, whether it is diagnostic errors like what ma'am was telling us about vacuumainers which were bad, or whether it is the machines not calibrated, they are the only ones who are at the bedside and who will be able to identify, and they should be given the confidence and the courage to speak up at the right point of time. That is one of the most important things I feel about the communication. Second, some time back, 15 minutes, 20 minutes back, I went and had water, and I felt very energized. So there are so many nurses, so much of time pressure, they don't have food, they don't have water, and they are dehydrated. And that inadequate staffing and pattern and the dehydration causes a lot of problems. So please take care of yourselves. First, eat well, drink enough water. I'm sorry. Okay. And the third part, which is the most crucial part, which I understand, is the training. In our nursing care plans, what we make, what is important is this particular case. What is a young nurse supposed to identify? What is she supposed to look out for? If my care plans are not good, if my care plans do not tell her what is to be assessed, she may miss it. So care plans are very important. How I train my nurses, how my nursing officer is able to identify, how my nursing officer will be able to speak up if there is a problem is extremely important. That system should be in place as far as I'm concerned. Last two more actually, handovers. Many people have spoken. In fact, one of the quality improvement project was there. Most important is handover. All of us are very busy, very tired by the end of our shifts. If I do not hand over, if I do not have a system of handing over, if I do not have a checklist for handing over of patients, of equipments, I may miss out, and that can be extremely dangerous. And technology and alarm fatigue, which we all understand, is very important. And there was this red flag signs which we need to teach to patients and their relatives. One more quality improvement project I saw, very beautiful it was. So red flag signs are to be taught to patients to identify it as soon as possible. Patients should be told what is to be expected of a particular thing, all right? And confidence and the culture of speaking up is very important. Did I take a long time?
No, I think you gave a mini lecture already. Okay. I keep wondering, how come our young nurses always clap when we say that, you are dehydrated, you should drink, we clap. Then we'll say your salary should go, we clap. Then I didn't hear anybody clapping when ma'am mentioned that as leaders, including me, we have to create a culture of listening. All youngsters should be able to speak up, and we should be willing to listen. So everything that is in their favor, they are clapping. Yes, so they are very much awake at that time. That is the current generation. So my next question is to Mr. Oleti, trying to understand that as you head the business, and you said you should not be called as heading the business, so I would like to know what would you like to give the title as. But when you look at reports, business reports have to be reviewed, it's very important. Otherwise, we will not be able to care for more patients. So when you look at that, maybe many times there are adverse events, they talk about adverse events. How many times are we able to deep dive into human factors? Was the right nurse in the right number at the right place? Was it there? If it's not there, why it didn't happen? Are the nurses, getting the break? Now they will clap. And they didn't clap, huh? You don't want to have break? Okay, they don't want to have break. So what I'm trying to understand is that, do we look at the human factors, not only of nurses, it can be residents, it can be anybody else, any workers for that matter. Classical case, doctors working for 3 days. Can they actually diagnose a patient correctly is the major challenge. So what is your take on that?
Absolutely. So to begin with, I'd like to be called an administrator, so that is perfectly fine. As leaders who are looking at hundreds of transactions happening within the hospital, right? a hospital which has, let us say, just a rough number, 100 beds, will be on an average seeing over 100,000 conversations happening on a day-to-day basis between our staff and the patients and the attenders, between the staff itself, and there will be multiple transactions along with the conversation. Not everything happens with the mouth, there will be talk and all those things. So we do two levels of analysis, and I would like to tell this that this is a very easy trick for everyone to follow. When you are overwhelmed with the number of transactions that are happening, it is physically impossible for one person to go through all of them to make sure everything is perfectly aligned and the true 100% is achieved or not. So what we do is, we have the top layer which is called a data-driven layer, right? So we get data from the ground, we understand what is happening, but it cannot be that once in a month I sit and understand how many adverse events have happened. That is post-mortem. The patient is dead and now we are now trying to find out what happened. But on a day-to-day basis, if we can get data and review this and see where the highlights are happening, then we look one level deeper, right? Wherever you see a red flag, then you go deeper into it and you try and find out where exactly the problem was. We looked at the fishbone analysis, we looked at RCAs, CAPAs, and so many ways of doing that. In our hospitals, we make it a point that the team that does the analysis is separated from the day-to-day activities. Their job is to do the analysis, and I would like to give a parallel to the airline industry. Till date, in the healthcare industry, everyone who wants to go to a surgery is very particular which doctor they are going to get a surgery from, right? How many of us just say, I don't care whichever doctor it is, as long as it is one of the big brands, I am okay to go ahead and get the surgery. But you look at it in the airline industry. When you are taking a flight, are you looking at which pilot is driving my plane? Never. Why? Because the systems have taken over the people, right? So when systems are strong enough, when we review, and whenever there is an accident happening on a plane also, it is not that there aren't any mistakes, right? To err is human, to forgive, we don't do that easily, but anyway, we'll come to that as a creating a culture of forgiveness. But the idea is that when in the airline industry, the analysis and the deep dive is so effective that once an incident happens, they make sure that the full root cause analysis is done, and this learnings that we get from this accident is spread across not only that particular airline, but across all the airlines in the world, so that the same mistake should never happen, right?
I am so happy that you have touched upon that point. I'm very, very happy to hear from a non-medical person about using that, example of airline, because WHO talks about this incident where I think Airbus had a accident, and they found one Airbus, the one that had, it has something called a condone cable or something, which was not right. So the entire industry, the entire plane was checked and the cable was replaced. So that's where their Six Sigma is more than 6, 7, 8, it's now reaching 9. And where is healthcare Six Sigma? Any idea? Those who know a little bit about Six Sigma, it cannot cross 4. So we have a lot to play. Now, what is your take home from his understanding is that when you make a mistake, please make sure that you are going and informing someone, by mistake this happened. And it is the leader's responsibility to listen and find that why did it happen, what is the process that can change, rather than how can I fix this girl or boy. Come here, I'm going to fix you. It doesn't work. Then the systems, they don't get better. So it has to be the system and the processes. And most important, immediately trying to share. When I was a critical care nurse, if anything I hear something happened in the medical ICU, I'm in CCU. I will check my process immediately to make sure that none of my nurses will make the mistake. The question to ask ourselves, do we reflect like that? Or we tend to say that, oh, it happens there, very good. She was thinking very smart. Today problem happened, very good for her. But it is bad for the patient. I think fantastic thought process, Mr. Oleti. Can I call you Akshay? Oh, thank you. So I like the name Akshay. So thank you, Akshay. We move on to Dr. Sangeeta. I'm going to ask a generic question like a medical doctor, not only as a microbiologist. So if you are a doctor, you already mentioned the role of nurses in the pre-analytic. Now I would like you to reflect upon, because I know that you are the youngest among all of us, and in your experience, do you think that the systems, they allow the nurses to be a partner to improve or strengthen the systems and the processes? I'm not going to hold you judgmental for your answer, but just a candid answer as to, do you think that our systems, healthcare systems, it doesn't matter which system, that have we evolved and we say, okay, they are supposed to be the front line soldiers. Let us empower them with the right processes and system, giving the environment for them to function without fear. So what's your take on that?
Yeah, of course. I obviously feel that, they are the angels, as you call them. They are the frontline workers. Be it any aspect, we think that nurses do play a role in each and every part of the healthcare system. So what I feel, maybe in a hospital setting, any blame comes, the doctor, the first person to blame will be a nurse. So you know that it is because you are responsible for each and everything in the hospital. So that is why you are being blamed for each and everything, because you play really a crucial, partners in each of everything, maybe partners in crime also. So the thing is, each error we identify, anywhere in the process cycle we get a nurse caught. So you mean how important you are in a healthcare setup. So it is now, only thing what I would like to tell is, medical field is something which is rapidly evolving. So you may think that, okay, I have finished my BSc nursing and everything, I am competent enough to do everything. You cannot be an all-rounder in everything. So the first thing is, you need to improve your skills and frequently keep updating your skills. That is very important here. Because here the senior nurses feel that I am a very senior person, I know everything, and they sit on it. They don't try to update even on the newest, because you know that it's a rapidly evolving, where we have even the IT systems being evolved. Even many people, they don't even know to touch a computer or run a computer or raise a test for us, nothing. So that is what the seniors think, that they are this one. Juniors are very scared to talk. So that, like ma'am said, the communication, and frequently, like ma'am has kept a conference, so frequently attending the conference, and something, at least one point you gain out of the conference and try to implement it in your healthcare sector. That will actually play a major role in each and every aspect that you are involved in.
Thank you. Thank you, Dr. Sangeeta. So when Dr. Sangeeta was mentioning the senior nurses needs to be updated, I saw an expression on Colonel Jyoti's face. The expression came only because you are updated. But I am very sorry to say, I am in the business that I run, I come across a lot of senior nurses. A lot of people come to me for training. And coming to patient safety, before we started the fellowship program, we needed to design what should be the content. So we ran a pilot patient safety quiz among leaders. Now I'll not tell you what where. The result was a big eye-opener. They really had no understanding of the real patient safety. Simple quality indicators also, the data is not very well understood. Happy 1.9, my favorite question is what? Apple, banana, orange, what? What 1.9? So the answer will sometimes become percentage, sometimes become something. I said there is a number there, 1.9 per 1,000 inpatient days, right? Unless you tell the full thing. It's not their fault, because everybody is just talking 1.9, 1.9, 1.9. And no one knows at the end of the road what is this 1.9. No idea. So I think that is what she was alluding to. And I totally admit that healthcare professionals, we just cannot afford to sit on our years of experience. Your years of experience should add to your knowledge and skills. That's the only way the youngsters will look up to you, yes, and you can give something. Otherwise, you make your cup once full, then you don't share it with anyone, no? How will you fill it up? So important to refill your glasses, share the knowledge and then refill. It's also for all the youngsters. Tomorrow you will be sitting here and talking. See that whether you have something to give when you come to this place. We are not going to sit here forever and discuss, right? So wonderful thought process coming now. Madam Sindhu.
I think I have something related to the previous question.
Okay, you can
Out
just
of-
add.
Yes, out of this, all these nursing professionals, how many of you are interested in learning the technology? The moment we go and ask, okay, very good, because we were going to each and every ward and asking for some kind of an adverse event which you have come across today with a ventilator circuit, or we asked something like whether the monitor was giving all the parameters in a proper way, whether the basic troubleshooting could be done and give a report to us. None of the nurses in NIMHANS was ready for that. So they were saying that no, we have enough work to do, so don't ask biomedical engineers work to be done by us. So there was a clear bifurcation that what can be done by the nurses and what has to be done by an engineer. But what we need is now, as part of this reporting of adverse events to the IPC, we are taking a big step that we can improve the quality by reporting those adverse events to the Government of India, which will be leading to a regulatory action against the manufacturer. So you all know that, I don't know all other hospitals in the corporate sector, but for the government hospital, sometimes we have to go through the tendering process. Our procurement process is so stringent. We may have to go only with L1, lowest quoted vendor. So to start with our gloves, from the gloves onwards, there can be a quality breach. So we only request the professionals who are there in the bedside to report those adverse events which can lead to the regulatory action against the manufacturer, which is I think the first step in the quality improvement. So
I think without asking, you added a very important point, that the government is taking the step that you can actually report. So in US, when you look at endoscopes, there is a site where you can go and report the company which manufactured, what was the problem. It's a government portal.
here
And the
also we have a
government will
portal.
ask so
We have our portal ADRMS. So it is an adverse.
please understand that any problems that you face with any equipment, first of all you should know the equipment. Don't use it if you don't know them. What is the use? Understand the equipment, and if it is not doing the right work and it's not right for the patient, please speak up. So we are all partners in the same delivery team. Unless we come together, patient safety cannot be achieved. That's what we all are agreeing. That's what we all are asking all of us to do it together. Can we do it? Yes. Okay, so the questions have to come from, I don't have time. Last I'll give you. Last. Okay, maybe the question will be your answer. You never know. First 3 rows are exempted. Question should come from behind. No, they cannot ask question. No. Sorry. Behind. Hello. The future nurses, you are sitting and clapping. Ask questions. After 3 rows. Hand. Oh, I am so happy. Please come forward. We have to give a very big hand for that person who is willing to speak up. So please come, my dear. Please tell your name, your hospital, and to whom the question you are asking.
Ma'am, myself Nandini. I'm from Cloud9 Hospital, Vartur unit. My question to Sangeeta ma'am. Ma'am, you were telling that sample was sent to, it was in normal saline where the sample has to be sent in formalin. I'm a OT staff, so I just want to know why is there a lack of knowledge shared between the lab and the nurses? Because I think most of our nurses will agree that most of them don't know what the vacutainers contain and why normal saline or the formalin, what is the purpose of it. So we all go through nursing education based on our nursing care and all that, but most of the time we lag in getting lab purposes, education. So I think most of our nurses would agree with this, and even some of the doctors don't know what does the transport media contain, because when they say the media has to be put it into transport media and it has to be sent. But what does the transport media contain? So I think most of them don't know about the purpose of it. That's why there is an error. So why do you think there is a lack of knowledge?
Lack of, yeah. Okay, so it's not a lack of knowledge. What I feel is your lab needs to, what we do, I'll tell you what we do. So any lab any nurse who steps in, that is during the induction, we have a session by the lab who teach them the proper sample collection techniques, because like ma'am asked me earlier, the nurses play the crucial role, because the pre-analytical phase or the pre-analytical errors are the most commonest what we face. So if you are ready to resolve that, I think our report will be 100%. So a garbage which is sent to us, we also give a garbage report, okay? So that should be always kept in mind. A garbage in is always a garbage out. So I don't think so so what we do is, we have an induction phase where we take classes mainly on the nursing part. We also include HIC, that is a hospital infection control practices. And the next thing will be the lab practices, what we follow. It mainly focuses on the sample collection part. So each thing, maybe a vacutainer what you sent, even that, the process, you tie the tourniquet for more than 1 minute, or you put the alcohol, you don't allow the alcohol to dry, that causes hemolysis of the sample. And I get a hemolyzed sample, I reject the sample, so you know the patient is wasting time, the resources are being wasted, the patient diagnosis is delayed by your simple act of not drying the alcohol before taking the sample. Okay, so it's basically you have to get trained. So you have to request your lab personnel to come and train you, and it should happen.
That's what the main purpose
it.
of my like questioning you is, because we are lacking in education from the lab people, or neither I request our nursing educators to put forward this topic henceforth, so that there is no any sampling errors happening, and the report would be
agreed, my dear.
Thank you.
Our fault. We will start introducing lab practices. And one more action, Dr. Sangeeta, I will invite you to do a webinar, a complete session.
Sure, I'll be happy to do.
And then it is your job to attend and learn. Okay? Are we done?
Because out of interest, I have done many studies on purpose of sampling in which solution and all that. So I wanted all my nurses to do that.
The moment you think about that, you are really saving hundreds of patients.
Thank you.
Really
Thank
great.
you so much.
Thank you, my dear.
Ma'am.
Thank you so much. And now that's the end of the questions from the audience. Madam Jyoti wanted to say something as the last takeaway.
I would like to make this as a closing comment, since we are running out of the time. Mr. Akshay mentioned that when the patients come to a hospital saying that which doctor is going to operate on me, I would like to see a day where, because we all understand that the doctor operates on the patient soon after surgery, from the time he is operated and till whomever the doctor is, he may be the most expensive doctor, but the nurses are the ones who are going to give care. So I'm waiting for a day where the hospital will be recognized for the nursing care rather than the doctor who is going to operate. So I look forward. Thanks so much. And secondly, about our young nurse talking about patient sampling, I think we need to improve our training, and I'm happy that this communication happened so that your hospital can take up training. This is very much a part of our training. Thank you so much. Thank you.
Thank you, ma'am. A lot of clap for the day. But I would tell you, because I got a call from a business leader asking me that I have this vision. Why I'm sharing this story is because they are thinking it is possible to get clients on the strength of nursing care. So he told me, ma'am, my vision is I should have hoardings, because every hospital will put pictures of the doctors and say, come to us. I want to put a hoarding, say, come to us for the best nursing care. And this is real story. So the challenge is on us, not on anybody else. Clapping is not good enough. We have to act so that they will trust to put that hoarding on the roads to say, come to us for the best nursing care. So thought on that very quickly from all of you on that hoarding. imaginary hoarding?
Absolutely.
Come to.
Caring with compassion is our tagline, and that is what we will ever have. Distinctive patient care is what will differentiate any hospital from the rest of the hospitals. So my closing thoughts will be all nurses, all the other staff in the hospital might spend a maximum combined 10% of time that the patient spends. Nurses spend 90% of the time with the patient, so nurses are the most important key link in this, right? And the chain is as strong as the nurses are. And that is why we are all coming for this conference with such excitement, because this is the future of healthcare, right? So a big claps to all of yourselves for doing such a great work. And this is where the patient safety guidelines also should emanate for all the others to pick up from. So on that note, I'd like to say that full credit to all the nurses who are doing a lot of work. Hospitals, if they have to grow, they will have to differentiate no longer on technology, no longer on infrastructure. It will be on compassion, it will be on safety, it will be on outcomes, and it will be on service. So that is the future.
Thank you. Dr. Sangeeta?
Yeah, so I'd be a one-liner, that is better to prepare and prevent instead of repair and repent. So that is what will be my, so better take home will be, try to improve your knowledge. Don't think that this is the end to it. You need to keep on updating your knowledge, and if you are not understood anything, feel free to communicate to your seniors. Communication and handovers, as ma'am has also said, that it's very important. And all the best to all the nurses, and hope so we will have much more future sessions on lab diagnosis and sample collection.
I have only two things to say. One, I think all of you have to go through that MVPI program, which is by Government of India. All of you can report all the adverse events which you come across, which will be one step for our country's quality and patient safety. Second one, I think here we are seeing from the warriors to the angels, and then what we wanted in 2030 is our SDG goal 3, no? So for the patient safety goal, we should see one slide that you are the gods, not the guardian angels. So this is where our supreme thing will be going on. So
Thank you so much, and wonderful panelist I had, yes? How do you show your appreciation? Thank you so much. Let's take a photo.
Thank you so much, Ms. Thankam Gomez, for moderating this panel discussion. Thank you to all the panelists. Now I would like to hand over the stage back to Ms. Madhira Paunam, who will host the valedictory session. Over to you, Madhira.